Hello and welcome to About the House. With over 1.5 million Australians living with diabetes, the House Health, Aged Care and Sport Committee has recently wrapped up an inquiry into what can be done to curb the growth of this disease in Australia. We caught up with members of the committee to find out more about the issue.
We have seen what an absolute emergency it is in its effect on the health systems and in communities around Australia. Some communities are being devastated. It is something that diabetes type 2 tracks disadvantage, and we're seeing in some of the most disadvantaged communities in Australia being severely affected by this health emergency.
Type 1 diabetes is an autoimmune disease and just like type 2, it is increasing in number worldwide. And I'm really pleased in this report we identified that COVID-19 is emerging as the trigger of type 1 diabetes, including in my son.
With many of the committee members being doctors with first-hand experience, they identified the importance of getting on top of this disease.
The way that our health system can be prepared is by preventing type 2 diabetes in the first place. And we know there's ways that we can do it. We see with the prevalence of type 2 diabetes and people above the healthy weight range that it is currently a societal problem requiring a societal response. So we need interventions that not only target the individual. If we only look at the individual, they will not be successful. We need societal responses to this.
We know that our health system, from primary care all the way to our hospitals, is under strain because of the increasing prevalence of type 1 diabetes, type 2 and gestational diabetes. And it's not just in that primary care preventative space. We do see acute exacerbations and issues relating to diabetes where people are presenting to the emergency department and then requiring intensive care management to bring their disease and the pathology under control.
Gestational diabetes was also looked at, with ongoing risks to mother and baby beyond birth.
Gestational diabetes is a massive problem for this country. It's when a mother develops diabetes during pregnancy, and it has really significant health impacts both for the mother, who has an increased risk of complications during that pregnancy, but also has a markedly increased risk of going on to develop type 2 diabetes down the track. But it also has consequences for the baby. Babies who are born after a pregnancy complicated by gestational diabetes tend to be bigger, and those children have a much higher risk of developing diabetes as well. So what we're seeing emerging is a cycle of disadvantage where women who have gestational diabetes are much more likely to have diabetes themselves, as are their children.
The committee has recently tabled its report with 23 recommendations on how the health system can tackle diabetes into the future.
We've got a great opportunity here to have a break in the trajectory that was going to deliver a tsunami of diabetes to this land. We've got a report now that is a wake-up call.
This requires a whole of government approach. This requires federal government intervention, state government, and also down to our local government with planning controls.
The committee had some really harrowing evidence from around the country of the effects of type 2 diabetes in particular and the complications. And we're seeing now children presenting with type 2 diabetes, which was almost unheard of 20 years ago. Those children appear to have a very rapid trajectory from their diabetes to complications, major side effects and major difficulties interacting with the health system. And it's across the board, whether it's ophthalmology with blindness from retinopathy due to diabetes, cardiovascular disease with early heart attacks, peripheral vascular disease with amputations, and it's affecting the entire health system. The incidence is increasing and we have to turn this around.
To read the full report, including the 23 recommendations, visit aph.gov.au/diabetes in Australia.